how could you just talk to children about a specific event, about like what happened this weekend?
Yeah, I think when we're talking to children, usually we're thinking about parents or caregivers, and a big part of your role as a parent or caregiver is to help your child feel safe and help them to understand the world. And so this event elicits feelings of fear and confusion, so it kind of does the opposite of that. And so how do you help them process that and bring them back to those things? I think to start, you want to actually have the conversation and do it intentionally if you can. So start a conversation that's open and honest. You want to model calmness for them. You don't want to come into that conversation, with heated emotions if you can, but you also don't have to pretend like the events didn't cause you to feel scared, that it's not something that is easy for any of us, and it's okay to be vulnerable with kids and tell them that it was a difficult situation for you too. So I think you want to start the conversation, from a good place, and then just be open. Ask them what they've heard, what do they know, and listen. And if some of the things they got wrong, to gently kind of give them the right information so that they really understand the events that happened. In a situation like this, kids are probably going to wonder, is this going to happen again? Or is this going to happen, to me? It was really what they're asking. They're asking, am I safe? And so as parents and caregivers, I think it's okay for us to reassure them, to say that the person responsible for this isn't a threat anymore. I think in this case, we can really highlight that there were other brave people that stepped up and helped protect other people. So I think those are things that you can do. And if you already have like a family kind of safety plan or crisis plan, you could review that or think about trying to develop a plan for your family in, scary situations. So I think that's kind of the big parts of that conversation. I'd trust your gut on your kids on kind of how appropriate it is to discuss it with them and in what way. Kind of most parents know their kids better than any advice I can give generically here. But so, you know your kids, trust your gut, give yourself some grace. I think that it might not feel like the conversation went very well, because these are hard conversations and kids are probably feeling some really big feelings and parents are probably feeling some really big feelings. But, it's just part of that parenting journey and one opportunity for you to help them, feel safe and understand the world.
And how do you fluctuate what you're going to bring up to your kid per se for their age group? Like if you're speaking to somebody that's just above 10 years old, or you're talking to a preteen, or maybe even a young adult?
Yeah, I mean, even within, actual biologic age, there's a lot of variation between kids. So again, I would tell parents to kind of go with their instincts on what their kid is ready for. I think with really young kids, maybe the advice is to shield them more from it, especially from media. They don't need to hear things on the radio or see it on TV in the background, because they just won't understand it and it'll be even scarier than it is. But for kids that are much older than 5, they're probably going to hear about it. This is a small community and a really big event in our community. So even they're out of school, but they're at summer camps, they're probably going to hear about it. So you don't want to avoid the conversation, because that can make it seem even scarier, as if like it's too horrible to even talk about. Or if they hear about it and you don't talk about it, they might be like, my parents don't even know that scary things are happening. Kind of, how are they going to protect me? So I think it's good to have the conversation in that kind of 5 to 10-year-old range. I'd keep it pretty simple about what happened and follow their questions. That will tell you where they're at and how they're processing it. And then for kids that are, older than 10, a lot of them will probably have really good questions, and a lot of the same questions that we all have about events like this. And, there you might want to be limiting kind of their exposure to social media, and still probably limit to some extent their exposure to all media. You just want to make sure that they're getting appropriate information and accurate information so that they're processing it based in fact and not kind of hype.
And if there is any signs of a child that might be struggling, or they're too scared to come out and just talk about it, how would you what are some of those signs, and how would you approach them on that?
Yeah, I think in situations like this, especially the closer a child is to the actual events, whether they were there, whether they had a family member there, is probably going to dictate the intensity of kind of those experiences for a child. But you might see them struggle to concentrate, right? Their mind is kind of lost in anxious thoughts, so they're struggling to focus. They might become more irritable. The younger they are, the harder it is for them to put into words the feelings that they're experiencing in a situation like this. So it's not going to be them just coming out and saying, I'm very anxious and I might be getting depressed, But as kids get older, especially this generation, kids are more open to being honest about their internal experience and seeing that as a valid experience and not something to be stigmatized. And so it's just, I think most important is fostering an openness within your relationship or within your family so that kids can feel comfortable in telling you what their experience is.
And for the parents' sake, how can a parent tell their child or notify their child that it's okay for them to come up and talk to them about whatever they may be going through?
Just tell them. I don't think you want to pressure kids to be, you don't want to badger them. As parents, we're used to experiencing badgering the other way, but you don't want to be like, just tell me your feelings, because they might not be at the point yet where they can share them or know how to share them. So you just want to, keep an open door, keep an open mind, check in with them, occasionally on it. And a lot of that depends on, how close they are to the situation and the intensity of which they might have gone through this experience, I think.
And can issues arise even days or weeks after a traumatic event, despite seeming like a person or a child is handling it well at first?
Yeah, absolutely. When people first go through a situation like this, kids or adults, the initial response might be just shock, right? Numbness, feeling kind of disconnected from reality. And that might look from the outside like going through it pretty normally. And then as things kind of settle down and the reality sets in, people start to deal with it and process it and find out that they're really struggling. So I think that's true for kids and for adults.
And kind of just a last question, when should you seek professional help?
So, we're only days out from this, and at this point, I would seek professional help if kind of those symptoms related to anxiety, fear, and going through this trauma are interfering with somebody's life. If kids aren't getting out of bed. I guess all of this is probably true for kids and for adults. You aren't getting out of bed. If you aren't doing the things, that you need to in your life, then that's a time to get professional help. If it's not that bad, but it's not getting better, weeks from now, then that would be another reason to seek professional help and mental health treatment. That the natural course is that it tends to get, a little bit better. It can be slow, but the progression is towards better. And so if people are feeling really stuck, then it's good to get help.